Welcome to the 8th episode of the AMREF podcast, Leadership in Health Education. I am your host, Halima Sabwa. Joining me in studio today is Professor Joachim Osur, Vice Chancellor of AMREF International University, AMU, and we will be discussing the importance of leadership in health education and how Professor Osur's insights can provide valuable perspectives on best practices. We will unpack how effective leadership can drive innovation, foster collaboration, and enhance the quality of health education, which will ultimately improve health outcomes across Kenya and beyond. Thank you so much, Dr. Osur, for joining us in studio today. And before we really get started on the podcast, I have a breaking the ice question for you.
Yeah.
So, what is the most memorable moment you've had at AMREF International University?
It's not long ago. It's actually when we had floods just the other day in Nairobi.
Mm-hmm.
And Kibera was very badly affected. Families were displaced and people were going without food. There was risk of disease. Everyone in the country was lamenting and wondering what to do because we were all affected in some way or another. And then I just learned that our students at AMREF International University had organized themselves, had gone around resource mobilizing, had gotten a lot of food and transport, and they were in Kibera distributing the food and giving people health education. That was for me phenomenal because I didn't expect students to do that.
And that's amazing because young people are actually stepping up and helping the community around them, acts of service, which is really important, especially when you're young. And that's a really great moment, especially.
Yeah. Because for AMREF International University, we keep telling them that it's not just education; it's solving problems.
Yeah.
The reason why AMREF International University was started is because we realized there was a problem in Africa. From the time of independence, those who remember, I was not there, but if you read history books, they will tell you that one of the reasons or the enemies that Kenya declared was disease, that there was a lot of disease, people are dying young.
Yeah.
And this was happening in most parts of the world. When you look at what has happened elsewhere, disease burden has come down. Deaths have gone down. People are living longer. In Africa, we are still having the same problem many years later.
Yeah.
And AMREF has been trying to find out what can we do to change this scenario. One thing that we've seen is we lack health workers.
And is that what inspired the creation of AMREF International University?
Yes, because lack of health workers is one big reason why disease remains a big problem. You need people who can not just treat in hospitals, but also work with communities to prevent disease. You need people who think globally and act locally, because we know solutions are there. So the university came up so that we train such people, but also innovate Africa-based solutions to our problems.
Yeah.
I want to give you an example why that is so important. During COVID, we didn't have our own solutions. We depended on solutions from elsewhere. And so we were told you can control COVID by locking down communities. So we went to Maasai land and told them you have to be locked down. How do you lock down a nomadic tribe with their cows?
It's not possible.
It's not possible. It means we are not having homegrown solutions.
Yeah.
And that is lacking across the board in health. We tend to implement things which are brought to us from other places. Solutions that have worked in the US, in UK and elsewhere don't necessarily work here. We are different.
Yeah.
But that is what we are doing all the time. So the need to come up with homegrown solutions, have people who can generate those homegrown solutions, do research locally and innovate locally. That is why the university was formed.
And honestly, having African solutions to African problems is very important, especially in the health space. Because if you look at the ICHI system that was developed in tandem with AMREF and the Ministry of Health, you can see that health workers actually go into communities, gather data, take that data, and then take it to healthcare facilities. So innovations like those are some of the things that we would be looking for as a continent. Especially in Kenya. And I would like to ask if, as a leader at AMREF International University, what challenges have you faced in health education and how have you overcome them?
You see, the biggest challenge in health education is that we want to be doing the same things as universities from the West. Let me explain. I call it colonization of education. The systems that we've adopted, the way we offer our lectures, the way we offer our degrees are very British or Western.
Yeah.
Noting that we are in a different context with no resources sometimes, and yet we have to still innovate solutions. So you have very bright students coming from very remote areas who cannot fit into the kind of education system that we have developed. That is a big challenge. Now, changing that thinking, let me give you an example. In medical training, we basically reproduce our ancestors. A good doctor is the one who behaves like the doctor of the 1940s, because the profession is past and you have to behave the same way. So whom are we behaving like? We are behaving like the old doctor in UK, in the US, because that is how we are trained. You are trained to behave in a certain way, dress in a certain way, diagnose disease in a certain way, but we are in a different context. And that is where the challenge comes. So how do we disrupt that? It also means disrupting the education regulatory system.
Yeah.
Because the Ministry of Education, the Commission for University Education, the Medical Practitioners and Dentists Board or the Nursing Council, we are all used to that Western system. How do we disrupt that? Can I have, for example, a system where if I grew up in Turkana or in Masai Land or in northeastern province where accessing a laboratory for biology is so difficult, can we have a system where I can still do medicine or nursing if I didn't have a biology lab in my school? Because right now what happens, the people who qualify to do medical or health courses are people who are from big schools.
Yeah.
And mostly it means they are people who can afford those big schools. So it brings inequality in access to education. Because you are disadvantaged from the start. You are in a poor primary school, so you can't do sciences. You go to a poor secondary school, you don't have labs, you can't do sciences, then you cannot qualify to do a health course. So you find in those places where there are no good schools, there are no health workers also.
Yeah.
Because people tend to, give back to their home places.
Communities, yeah.
To their communities. So if you didn't train a health worker, you will most likely will lack health workers in that area. So what we are doing in AMREF is to work with the ministry, ask ourselves, how do we make sure that if I was born in Turkana, if I was born in Samburu, if I was born in a poor locality, sometimes it is in Nairobi, but I'm born in Mathare, how do I ensure that those people still have access to health education? How do we contextualize health education to our environment in Africa without making it British or American?
Yes, and honestly, that is very important because at the end of the day, we need to break our reaches, or not our reaches really, but our ties to our old systems of learning. And when you're talking about nurses being sent, or like if there's a nurse in Samburu and she's being sent to her community to help, that would also make her an advocate for change in her community, because then other people will see that it's possible for me to do what this nurse is doing. And even as it comes to how women give birth in hospitals versus traditional health attendants, there are some things that we can learn, and especially since some, like in the Maasai community, there are a lot of people who do not have access to good roads. So getting to a level 4 or 5 facility, especially if you're having complications, can be very difficult because, maybe you've even breached.
Yeah.
So having healthcare promoters actually going to the communities, listening to the communities, having a participatory approach where, the community gets a say in how they get healthcare, and the healthcare attendant actually understands what the community needs, really goes a long way.
And this is why when you asked me, you asked what has made me happy. What did you ask?
I had asked.
To break the ice.
Yes, I had asked.
What made me happy recently?
Yes.
And I told you it is when these students, on their own volition, without anybody instructing them, did something for people in Kibera.
Yeah.
Because for me, that is what it is, being able to identify critical needs in communities.
Yeah.
So the training should be such that I'm able to see where the problem is and innovate solutions for it. And we are also hoping that then it is done in a big scale.
Yeah.
So exactly what you're saying, can we connect our classroom to communities? Can we have students who are able to identify critical problems in health and innovate solutions for them without anybody instructing them? I think that is what leadership is about.
And I agree. And we've been talking a lot about innovations with AMU and communities. So what role does innovation play in health education? And how do you encourage innovative thinking amongst your faculty and your students?
Yeah. So I start by saying that it is lack of innovation that has brought us to where we are, trying to do the same thing all the time and hoping to get different results. Training the doctor, the nurse, the community health worker the same way since 1963 to date, and hoping that they will innovate solutions that will disrupt the current scenario in our health system, which is really bad. There are a number of things we are doing to break that cycle. One of which is just what we've said, ensuring that people who come to class, they understand their communities. They know what is going on. So that when they get knowledge in class, they look at scientific evidence, they're able to start thinking, how then can I solve that problem I've seen in the community? Our training institutions don't traditionally do that. The curriculum does not necessarily take you back to your community. In fact, what we've seen, it takes you away from your community. People train and they run away to another continent. So there is a disconnection. So ours is to really create that strong connection between academia and community needs, and connect students to those communities and make training very practical. So that is one. But we have also seen the curricula are very regulated. We talked about there are all these traditional ways of regulating education, which are in place, they serve a purpose, and so on. So they are there. So it means if I'm training in nursing, there are things I must cover as a basic, requirement by the commission, by the nursing council, and by everyone. We do that. But then we have to add something else. We call them micro-credentials. In addition to being a nurse, do you have knowledge, for example, to identify those problems in communities? Do you have knowledge to do financial management so that your services can be cost-effective? Do you have knowledge to be a good communicator of the problem? Why is it that there are diseases in communities, doctors are seeing them every day, nurses are treating them every day, but nobody talks loudly? It's because they're not given communication skills. So micro-credentials, we really encourage that entrepreneurship approaches to offering the care they offer. Right now, the biggest challenge in health is financing. You remember the whole discussion about NHIF, corruption.
Yeah.
Now we have social health insurance fund. It's just messy. It's just messy. And you can easily die, not because we can't treat, but because you can't afford the service.
Yeah.
Hospitals are lacking medicines. There are doctors not employed, not because we don't have doctors. It is because we can't absorb them and pay them.
Yeah.
So there is a big challenge there. So how do we give these additional skills so that if I qualify as a health worker, I also think entrepreneurship, I think finance, I think health funding, I can innovate solutions that will help me to survive in this very difficult environment and still be able to offer quality services. So micro-credentials, very important. Yeah.
So one thing I'd like to mention is brain drain. Brain drain is a big problem, especially when it comes to the health space, because you're right, a lot of people in the medical profession run away from the communities that they're supposed to serve, and a lot of times it's because of financing, because our government cannot absorb all of the doctors, and we need more doctors, and also this discrepancy between public and private hospitals, right? Public hospitals are usually overwhelmed, and private hospitals are too expensive, and the majority of the Kenyan population, and I'd like to say the African population, cannot afford it. So, and with people not making as much and still having to access health services, it's going to be very difficult to kind of find a balance between those two. And talking about what you call them, micro credentials, that's really important, especially when it comes to financing, because at the end of the day, even if you do not have the resources, knowing how to allocate allocate what's most important, being able to communicate with your communities is really, really important.
Yeah.
And I wish we could actually find a way so that everyone can access healthcare services, whether you are in urban areas or rural areas, because at the end of the day, it's people from last mile communities that get the least availability of healthcare services, and also the quality of service delivery sometimes might not even be possible because some of those hospitals are overwhelmed.
In fact, the one thing we really have to disrupt is the two, there are basically two health systems in Kenya.
Yeah.
There is a system for the poor
And
and one for those who can afford.
Yeah.
If you have malaria today, if someone in the village has malaria today, they are likely to go to a pharmacy to buy Panadol. And then if it doesn't work, they will go back and maybe buy something else, sometimes an antibiotic. And sometimes they might get an antimalarial. Reason being, one, maybe the hospital is far, but even if it is near, I don't have money, I don't have insurance. That is one health system. And many people die from preventable diseases because that system for the poor doesn't work. On the other hand, if someone can afford, they have a fever today, they go to the highest private hospital, they get even unnecessary tests because they can afford, they will be tested, everything that you can think of, and given the best medicine in the world. They are still Kenyans, but they have two different health systems. For me, that is an injustice. Your health is a right. Your economic status should not determine whether you get treatment for malaria or not. We have, according to our law, we both have a right to access health services. So we really need to disrupt that. And I don't know how to do it, but we need to have a mindset where some of these services become basic for everyone, human rights for everyone. the government, we in the education, the private sector, we should develop people who think in that way.
Yeah.
Yeah.
And as we are concluding, in your opinion, what are the most critical skills and qualities that future leaders in health education should develop?
Yeah, I think we need to stop. The world has changed.
Yeah.
So we need to think differently. We need to break those traditional systems. If you asked me, maybe we don't even need the degrees we have now. We need to have a different, for example, I'm a doctor originally. With AI now, people already know so much when they come to me. There are things that if I keep reciting to them, they already know I'm wasting their time. So we need to think differently. What is the role of technology? What is the role of AI? How do we then change the curricula to take care of all this? In China now, they're even having a whole hospital run by robots. So what is the role of a doctor now?
I think I do agree with you, but I think there needs to be balance.
There needs to be balance,
Yeah.
but we cannot have business as usual.
No, and that's true, because even in Kenya, we were implementing as part of AMREF artificial intelligent TB machines. So what that means is that it would look at the nodules of the lungs and address whether someone has tuberculosis, etc. And it can really help a lot of facilities in Kenya, especially with the gap in healthcare. So in so much as China has a hospital that is run by robots, sometimes when you're sick, you just need to see another human being and a face, So that's why I'm saying...
Do you know also, just as COVID was coming towards the end, you remember diagnosis was a problem. We couldn't get diagnosis kits and all.
Yeah.
I think it was in UK or some place where the dogs were trained to just smell you and say, this one has COVID. We have to think differently.
Yeah.
I think that's what I mean.
Yeah.
It can't be business as usual. Technology has grown. It's a different world.
Yeah.
So using the same curricula, the same approaches that was left to us by our colonial masters, having the same education system, the same degrees. If you did the degree I did, it is Bachelor in Medicine and Bachelor of Surgery. It was done before colonialism. It is being done today. It is the same thinking. We have to change.
Yeah. I agree. And my last comment is that at the end of the day, yes, we need to change how we look at the world, but at the same time, we also need collaborative efforts between universities, governments, and different organizations, NGOs, and other partners. So how do you feel like collaboration can enhance the effectiveness of health education programs?
Collaboration is very important. As I said, we have to bring down our training to the level where academia and real life are meeting. So we need communities to enrich our academic programs. The regulator needs to take cognizance of that. The government needs to provide a policy framework to enhance that. So, and private sector, industry that is commercial needs to be part of that. So that when we train and someone comes out, they are well-rounded. They are able to understand all these sectors, and they can fit and provide the best service within the context that we have.
Okay. And honestly, thank you so much, Dr. Joachim. This has really been an informative discussion, because I did not know that dogs were being trained to, detect COVID. Yeah. I knew that in China at some point during COVID, those Q-tips that they inserted in your nose, they had robots doing that, but I genuinely did not know there was like a whole hospital that is just being run by robots.
That's
And disruptive education is extremely important. So thank you so much for being a guest.
Thank you.
And I really hope that, I know you guys, AMU is moving to
just opposite KU.
Yes.
We have a big new campus coming up.
Yeah.
It will be the main campus, or really the only campus for now, because we will move there, everything.
But I think I'll miss you guys just being a hop skip away. But I wish you the best in all of those endeavors, and thank you so much for joining us today.
Thank you very much.
Yeah.
Yeah.
Thank you, Professor Osur, for sharing your valuable insights and expertise on the importance of leadership in health education. Effective leadership is essential for driving innovation and collaboration in the health space, and the strategies that AMREF International University employs are truly, truly inspiring. To our listeners, thank you so much for tuning in to the 8th episode. This has been your host, Halima Sabwa. And if you have any questions, thoughts, or feedback, please reach out to us on social media, which is Twitter at @amref_Kenya, Facebook at @AmrefKE, and Instagram at @AmrefKenya. We would love to hear from you, and goodbye for now.